Okay, so let's talk about something that's actually kind of a medical mystery for a lot of people. How can your own body's filtering system, your kidneys, completely change the right dose of a medication? Let's get into it.
I mean, have you ever really thought about that? You get a prescription for, say, 500 milligrams, but your friend gets half that, just 250, of the exact same drug. Well, I can tell you, it's definitely not random. In fact, a huge piece of that puzzle is hidden inside one of the hardest working organs you've got.
And yep, you guessed it, that brings us to the kidneys. The best way to think about them is as the master filter for your entire body. They're just constantly working 24/7 behind the scenes, keeping everything running smoothly.
I mean, every single day they're pulling waste out of your blood, making sure your body's fluids are balanced, and here's the key for our conversation, they're the main exit ramp for a ton of medications after those drugs have done their job. But here's the thing. This master filter isn't indestructible. Really common conditions that affect millions of people, things like high blood pressure or diabetes, can actually damage the kidneys over time. This leads to something called kidney insufficiency, and it's why this topic is so incredibly important for so many of us.
So what happens when this incredible, fine-tuned filtration system starts to slow down? Well, this is where we get to the heart of the problem and exactly why your doctor might need to change your dose.
There's a medical term for this. It's called uremia. And it just means that when the kidneys are impaired, they can't get rid of waste and drugs like they're supposed to. So that stuff starts to build up in your blood, and that can become pretty dangerous.
Think of it like this. With healthy kidneys, a drug goes in, does its work, and gets cleared out nice and efficiently. But if those kidneys are impaired, the drug just hangs around. It sticks around way longer, and with each new dose, the level builds up and up, until it could even reach toxic levels.
And here's the science behind it straight from the source material. It's all about pharmacokinetics. Now that sounds super complicated, I know, but it's really just a fancy term for how a drug moves through your body and, more importantly, gets cleared out. When the kidneys slow down, that whole process gets thrown off. Okay, so we know there's a problem, but how do doctors actually figure out how clogged that filter really is? Well, this is where some pretty clever detective work comes in, and the main clue is a molecule called creatinine.
You see, creatinine is a totally natural waste product. Your body makes it all the time, just from using your muscles. And normally, your kidneys are supposed to grab it and filter it out. So, if you measure how much creatinine is just floating around in the blood, you get a really good idea of how well the kidneys are doing their job.
In a healthy person, it's a perfect balancing act, you know? The amount of creatinine your muscles make is the same as the amount your kidneys get rid of. It keeps the level in your blood really stable. So, if that level starts to rise, it's a huge red flag that the filters are having trouble.
But, and this is where it gets really interesting, it's not just a simple numbers game. Your age, your gender, how much muscle you have, even what you eat, all of that can change what a normal creatinine level looks like for you. A young muscular athlete is going to have higher levels than a small, older person, even if their kidneys are both perfectly healthy.
Because of all that complexity, doctors need a way to turn that raw number from a blood test into a much more useful, much more personalized picture of what's really going on with the kidneys. Let's see how they do that. So, instead of just staring at that one creatinine number, they calculate something called creatinine clearance. Basically, it's an estimate of how much blood the kidneys can clean, or clear, of creatinine every single minute. It's a way more powerful and meaningful number. So how do they get it? Well, one of the go-to tools is a math equation called Cockcroft-Gault. It's really clever. It takes all those complicated factors we talked about, like age and weight, and combines them with the blood creatinine level. What comes out the other end is that one really solid estimate of true kidney function. And here's why that number is so powerful. That final creatinine clearance estimate lets a doctor classify a person's kidney function into clear, distinct stages, from totally normal all the way down to severe disease. And that classification, that's the key to making smart choices about medicine. And that brings us to the final, and let's be honest, the most important piece of this whole puzzle, the solution. Now that we know how well the kidneys are working, how do we actually fix the prescription?
So the whole idea is actually pretty simple and elegant. You have to match the drug input with the body's new, slower output, right? If the filter is only working at half speed, you can't just keep pouring in the medicine at full speed. You've got to slow down the input to keep everything in a safe, therapeutic balance. And clinicians have two main strategies for doing this. The first one is pretty straightforward. Just reduce the dose. So instead of, say, 500 milligrams every 12 hours, it might become 250. The other strategy is to extend the time between doses.
So you still take the full 500 milligrams, but maybe only take it once a day, giving your kidneys more time to clear it out.
You know, these two strategies are basically the foundation for all official drug dosing guidelines. The whole point is to keep the amount of that drug in your body in the sweet spot. You don't want it so low that it doesn't work, but you definitely don't want it so high that it becomes toxic. Oh, and an interesting side note, often that very first dose, the loading dose, can stay the same. It's every dose after that, the maintenance dose, that needs to be adjusted.
And this quote from our source material really just nails it. It's not just about the drug. It's not just about the disease. The maintenance dose is specifically tailored to the clearance ability of that individual patient.
So what's the big takeaway here? What's the bottom line? It's that one-size-fits-all just doesn't cut it in medicine. Looking at your kidney function and adjusting your prescription based on that, that's not just a nice idea, it's an absolutely fundamental part of keeping patients safe in the modern world.
And that kind of leaves us with a final thought to chew on. We've just seen how dramatically one single biological factor, your kidney function, can change everything about a prescription. It really makes you wonder, doesn't it? What other unique things about our own bodies might be influencing the perfect dose for each and every one of us?